1. What is allergic rhinitis?
Allergic rhinitis may be defined as intermittent or seasonal allergic rhinitis and as persistent or perennial allergic rhinitis. Symptoms of allergic rhinitis include sneezing, itching of the eyes, nose, and throat, runny nose, and nasal congestion with positive immunoglobulin E test results for specific aeroallergens, like seasonal allergens of tree, grass, and ragweed, and the perennial allergens of dust mite, cat, dog, and cockroach droppings.
2. How common is allergic rhinitis?
Allergic rhinitis affects about 15% of the U.S. population, or 50 million people, and 500 million people worldwide. Allergic rhinitis is associated with conditions like asthma, eczema, chronic or recurrent sinusitis, cough, and both tension and migraine headaches.
3. What is seasonal versus perennial rhinitis?
Seasonal allergic rhinitis may present with symptoms that occur at about the same time each year, precipitated by aeroallergens from tree, grass, or ragweed, when the pollen is most prevalent in the environment. Perennial rhinitis occurs throughout the year and is triggered by allergens like dust mites, molds, cockroach droppings, and pet dander.
4. How is allergic rhinitis treated?
Patients with allergic rhinitis should avoid inciting allergens. Treatment for mild intermittent or mild persistent allergic rhinitis include a second-generation H1 antihistamine, like cetirizine, fexofenadine, desloratadine, loratadine, or an intranasal antihistamine, like azolastine or olopatadine. People with persistent moderate to severe allergic rhinitis are treated initially with an intranasal corticosteroid, like fluticasone, triamcinolone, budesonide, mometasone, either alone or in combination with an intranasal antihistamine. Therapy for non-allergic rhinitis consists of an intranasal antihistamine alone or in combination with an intranasal corticosteroid.
5. How does allergic rhinitis affect your life?
Allergic rhinitis is associated with impaired quality of life and significantly increased healthcare costs. It is associated with fatigue due to poor sleep quality and adverse effects related to medications. It is associated with impaired physical and social functioning. About 30% of people with allergic rhinitis have cognitive and memory impairment, about 30% have anxiety and depression, about 82% have impaired work quality, and about 92% of children have impaired school performance. It is associated with increased direct costs, like medications, office visits, and procedures for comorbid illnesses, and indirect costs, like work or school absenteeism.
6. How is allergic rhinitis distinguished from mixed or non-allergic rhinitis?
Allergic rhinitis is associated with positive skin prick testing or with positive serological testing for immunoglobulin E aeroallergens. Non-allergic rhinitis does not have these characteristics. A history of symptoms in association with the patient exposure to sensitizing allergens suggests allergic rhinitis. Non-allergic rhinitis is associated with exposure to chemicals, like cleaning agents or solvent or irritants like tobacco smoke or perfumes, and with exposure to abrupt changes in the temperature.
7. What are the risk factors for allergic rhinitis?
Risk factors include personal and family history of allergic rhinitis, asthma, or atopic dermatitis.
Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.